Hello everyone and welcome to our presentation. We are Group 5 and our program will be focusing on mental health in youth. This project was crafted by Francis Brock, Bouquet Isteven, and Kelsey Marshall. The instructional in-service education program we chose to develop will inform faculty and staff on how to implement mental health interventions that targets the most prominent mental health concern affecting their student population. We have done research on the effects mental health has on academic performance for students in grades K through 12. We chose this program because it is fully customizable and can be implemented by different schools or districts. They may choose to focus on one or multiple mental health concerns, tailoring the interventions to the needs of their students to enact proactive change around the school. First, we will discuss the prevalence and trends in increasing mental health concerns amongst youth in accordance with the 2022 National Healthcare Quality and Disparities Report. It is important for the staff to be educated on the statistics that apply to their students. Nearly 20% of children and young people ages 3 to 17 in the U.S. have a mental, emotional, developmental, or behavioral disorder, and suicidal behaviors among high school students increased more than 40% in the decade before 2019. 15% of youth ages 10 to 19 experience a mental health disorder, accounting for 13% of the global burden of mental health disorders. The Health Resources and Services Administration conducted a study which concluded that between 2016 and 2020, the number of children ages 3 to 17 diagnosed with depression grew by 27%. The percentage of adolescents ages 12 to 17 who received mental health services in a specialty mental health setting in the past year increased from 11.8% in 2002 to 16.7% in 2019. On this slide, we will discuss mental health and academic performance, a study on the selection and causation effects from childhood to early adulthood. This study uses predicting factors to determine how a child will perform at higher levels of education based on internalized and externalized emotional and behavioral concerns at ages 3, 12, and 20. The study requires parents to provide written consent for the child to be enrolled at each stage of development. Through the use of 5 hypotheses listed, the study investigated the association between mental health and academic performance at different periods of childhood and adolescence. 1. Internalizing and or externalizing problems at age 3 increases the risk of poor academic performance at 12. Internalizing or externalizing problems at age 12 increases the risk for incomplete final grades from age 15 to 16. Internalizing or externalizing problems at age 12 also increases the risk for non-eligibility to higher education at 18 and 19. Incomplete final grades from 15 to 16 increase the risk for internalizing and externalizing problems at age 20, and non-eligibility to higher education increases the risk for internalizing and externalizing problems at age 20 and beyond. Externalizing problems include conduct disorder and oppositional defiant disorder, which implicate behavioral disturbances that could affect the adjustability in the classroom and thereby performance. Internalizing problems include mental health conditions in which negative emotions and distress are turned inward instead of expressing them to others. Internalization can manifest as emotional withdrawal, anxiety and depression, and perfectionism. Results were determined through student self-reported standardized questionnaires on mental health and well-being, as well as teacher-rated academic performance for reading, mathematics, and English. Some of the survey tools used included the Edinburgh Postnatal Depression Scale, the Child Behavior Checklist, and the Strengths and Difficulties Questionnaire, as well as the Symptom Checklist. In accordance with the study on the previous slide, the results express the association between internalizing and externalizing mental health concerns and subsequent academic achievement. Mental health concerns at preschool age was associated with poor academic performance in English and math at age 12. Internalizing problems at age 12 did increase the risk for incomplete grades at ages 15 and 19. Internalizing problems in early school age has been shown to diminish the chances of completing a high school degree. Externalizing mental health concerns can present as behavioral disturbances that could affect adjustability in the classroom and performance. Early behavioral problems might also trigger child-teacher conflicts and social exclusion, leading to negative experiences of the school environment. 2 examples of behavioral disorders include conduct disorder and oppositional defiant disorder. These disorders cause behavioral disturbances through patterns of anger, irritability, arguing, and violating social norms or others' rights. They can cause a significant disruption in a child or adolescent's life, impacting social, academic, and occupational functioning. This is not to say all unaddressed mental health concerns will lead to these disorders, but disruptive behavior can have long-term negative effects on the student and their classmates with lack of intervention. The study determined externalizing problems at age 3 increased risk for incomplete grades, and conduct problems at age 12 did increase the risk for incomplete grades and non-eligibility for higher education. Students who externalize their mental health concerns present with behavioral issues that disrupt their ability to learn. Students who internalize their problems struggle to complete work and to graduate. Overall, this study determined that students who repress or do not address their mental health concerns at each age level are at higher risk to struggle as they progress academically each year. The goal of any mental health awareness program is to find the best practices for fostering a healthy student environment. One way to promote mental health in school is by increasing students' mental health literacy. Increasing literacy decreases anxiety and depression by decreasing confusion and fear, thus creating a sense of awareness and understanding. Another way to support students' mental health in schools is by promoting mindfulness. Mindfulness education supports students' awareness of the mind-body connection through linking physical symptoms and the emotions that drive them. Further strategies to reduce mental health concerns include promoting social, emotional, and behavioral learning, as well as enhancing connectedness among students, staff, and families. Improving education and collaboration amongst all those involved in the school community aids in decreasing misunderstandings and generates a cohesive environment. The last strategy, potentially the most important, provides students with psychosocial skills, training, and cognitive behavioral interventions to address their individualized mental health concerns. Interventions and training give students the power to feel confident in their own ability to de-escalate their emotions if need be. This program aims to create an environment where students feel safe and understood. These strategies were provided by the source Promoting Mental Health and Well-Being in School, an action guide for school and district leaders. Through counseling, education, interactive activities, and the supplied resources, students will feel more confident in their ability to navigate mental health concerns. Each of these strategies represent an attainable goal for the school community to strive for when providing mental health care to students. In implementing a school-wide mental health awareness program, it is important to note that there are levels to break down how support is provided. The first level being universal and primary prevention programs that are implemented school-wide and affect the entire student body. Support can be provided by any adult member of the school community. This promotes positive social, emotional, and behavioral skills for overall student wellness. The second level consists of targeted or secondary prevention to groups of students who are identified to benefit from additional support, skill development, or early intervention to address concerns. This support is provided by professionals with specialized training, such as school counselors. The last level, Tier 3, is made of indicated or tertiary prevention programs, targeted for students with serious mental health concerns that impact daily functioning. Tier 3 often encompasses students who require individualized education programs, or IEPs, and typically require paternal consent for student participation. On this slide, we have a personal statement from an NJ student. She explains, I was also having issues with my friendships at school, and an increased level of stress when it came time for tests, projects, and other assessments. The feeling of isolation, lack of appetite, and absolute hatred of school were not normal. We found this statement crucial to our presentation because anxiety and depression are the most prevalent mental health concerns in youth, as seen in statistics and personal statements. To understand anxiety disorders in adolescents, it is better to first provide education on anxiety disorders as a whole. Most people experience worries and fears related to daily life, such as work, school, family, social, health, and financial problems. Most of the time, those worries and fears are considered normal emotions that everyone may experience from time to time. However, these worries and fears can gradually increase over time and become persistent. Worries and fears are classified as an anxiety disorder if they interfere with our ability to manage daily tasks, such as a decline in school performance and social challenges. Anxiety disorders in school-age kids are serious and affect their emotional, behavioral, and physical development. In this presentation, we will provide education on 3 potential anxiety disorders that impact youth and adolescents: social anxiety disorder, generalized anxiety disorder, and panic disorder. Social anxiety disorder involves individuals experiencing intense fear and anxiety in social settings, mainly due to a strong fear of being judged, rejected, humiliated, or negatively evaluated by others. Triggers for social anxiety disorder include meeting with new people, flirting, speaking in front of a large crowd, such as classrooms, and being interviewed. Asking for help in a public place, making a phone call, or ordering food in a restaurant or store setting, and even eating out in front of people. Many of these things all happen within a school day. The most common signs and symptoms of social anxiety disorder are anxiety, worry, and fear. Additional symptoms include facial flushing, dry mouth, feeling anxious in social situations, heart palpitations, trembling, sweating, dizziness, stuttering or a trembling voice during speech, stomach aches, replaying social interactions repeatedly, and experiencing intense fear of interacting with or speaking to strangers. People may also experience difficulty performing tasks while others are watching due to the feeling of being judged. To diagnose an individual with social anxiety disorder, they must experience the above mentioned signs and symptoms persistently for 6+ months, and it interferes with the individual's ability to complete daily tasks such as attending school. It is treated with psychotherapy, cognitive behavioral therapy, medication, and support. Generalized anxiety disorder is a state characterized by psychological and physical effects often occurring during or after periods of high stress, fear, or excitement. Anxiety is one of the most profound influences learned from a young age and often causes adolescents to struggle with coping throughout their life. For students, stress is often unavoidable due to their unique circumstances. If not managed well, this stress can lead to ongoing anxiety during their academic life or, in severe cases, result in trauma that affects their future. When students are exposed to this state of anxiety for extended periods, their bodies begin to react physically, not just psychologically. From the moment these physical reactions occur, students begin to experience increased anxiety and worry. It is at this point that the condition generalized anxiety disorder begins to develop. Physical manifestations of symptoms include hot flashes, muscle twitching and tension, a rapid heart rate, and increased blood pressure. Feelings of dizziness and lightheadedness, nausea, chills, cold sweats, and shivering. Worrying excessively, inability to sleep, difficulty concentrating, irritability, and tiredness. To receive a diagnosis, symptoms must persist for at least 6 months, and most individuals must experience 3 or more of the symptoms listed above, such as difficulty sleeping, irritability, restlessness, and muscle tension. Treatment involves psychotherapy, which can be done with counseling, cognitive behavioral therapy, or medication such as antidepressants or anti-anxiety medications and support groups. A panic attack is a sudden and unexpected episode of intense fear, anxiety, or discomfort. This attack, which usually lasts a few minutes, makes a person feel a serious sense of threat or danger, even when no real danger is present. The fear during a panic attack can be so strong that the student might fear losing control, fainting, or dying. It is accompanied by a physical symptom and is often mistaken for a heart attack or other serious medical issues. Panic attacks can happen only once or become recurring. In such cases, the person could be diagnosed with panic disorder. Adolescents with panic disorder constantly worry about their next panic attack, which can negatively affect their social life, academic performance, and well-being. Panic attacks can also co-occur with other mental health issues, such as depression and anxiety disorders. The frequency and severity of these attacks vary from person to person, but they generally cause significant distress. Panic attacks show both physical and emotional symptoms. These symptoms often come on suddenly and typically peak within a few minutes. The most common symptoms during a panic attack are heart palpitations, rapid heartbeat, shortness of breath, or a sensation of suffocation, chest pain or tightness, dizziness, lightheadedness or fainting, sweating, tremors or shaking, nausea or abdominal pain, and fear of death. To be diagnosed with panic disorder, the student must have recurrent panic attacks, consistent worrying for at least a month that they may experience a panic attack, worrying about the panic attack, and trying to change or prevent future attacks. Treatment similar to other anxiety disorders such as psychotherapy, cognitive behavioral therapy, or medication such as antidepressants or anti-anxiety medications and support groups. Major depression is a mental health condition that causes a persistently sad or depressed mood, hopelessness, and a loss of interest in daily activities usually enjoyed, preventing students from completing their schoolwork and maintaining healthy relationships with their classmates and friends. Depression can occur due to hormonal changes, but it can also be the result of psychological and social factors. According to Mental Health America, 3.1 million kids ages 12 to 17 suffer from major depressive disorder. Signs and symptoms of depression include sadness, hopelessness, poor performance in school, low energy, lack of interest in activities, agitation, restlessness, and inability to sleep. Some teens react to depression by seeking help from drugs or going against authorities. To diagnose major depression, a person must have above-mentioned signs and symptoms lasting all day, every day, for a minimum of 2 weeks. It must include a lack of interest in activities. Psychotherapy is effective in treating major depression, which can be managed with antidepressant medication, and support from family and school is also essential. Screenings can be done at various points of a student's educational journey to evaluate how mental health affects their school performance. Schools can measure the effectiveness of mental health awareness programs by comparing screening data before and after proactive mental health interventions are initiated. They can also conduct screenings at the beginning, middle, and end of the school year. This would provide data on the levels of student mental health concerns at different points in the year to better understand when targeted interventions are the most essential. Schools can have guidance counselors, nurses, and any other trained mental health professional perform these screenings. Some screenings listed to be utilized include the School Mental Health Quality Guide, the School Counselor Universal Screening, the Guidance for Trauma Screening, and the best practices in universal, social, and emotional behavioral screening. Universal screening in school provides a systematic method for gathering data on the student's academic, social, emotional, and behavioral well-being, as well as the mental health indicators of that population. Next, we will discuss how to implement the following strategies to meet the goals of our program to increase student mental health literacy, promote mindfulness, promote social, emotional, and behavioral learning, enhance connectivity among students, staff, and families, and provide psychosocial skills training and cognitive behavioral interventions. By implementing interventions to meet these goals, the school will create a positive mental health environment, a space either physical or social that supports and promotes the overall well-being of the students, fostering a relationship with students that reduces the risk of mental health challenges and encourages safety, support, and opportunities for connection and growth. Schools can increase students' mental health literacy by implementing classroom-based mental health education curricula and peer-led programs. Education material to be provided includes the causes and symptoms of mental illnesses, analyzing stigma, how it applies to mental illness, and ways to reduce stigma, educating on the treatment of mental illness and barriers students may face in seeking that treatment, as well as encouraging students to talk with trusted adults to be open about their concerns and needs. All of the education provided earlier in this presentation on signs and symptoms, diagnosis process, and treatment of anxiety can be shared with students to increase their mental health literacy. In the CDC's Action Guide for Promoting Mental Health and Well-Being in Schools, middle and high school students who participated in mental health literacy education reported less negative emotional responses toward people who have a mental illness and were more likely to interact with people, including their peers, who have a mental illness. Improvements in knowledge and attitudes toward mental illness that lasted over time, more help-seeking behaviors, and greater optimism about treatment effectiveness, fewer worries about sharing personal information with a counselor. Outcomes of successful mental health literacy education include increased mental health knowledge and attitudes, and decreased stigma related to mental health, and increase in help-seeking behaviors. It is important for school to dedicate time for students to individually practice mindfulness. One way to do this is to offer small group activities. Classroom-based education supports student awareness of the mind-body connection. Mindfulness activities include instruction about stress, the effects of stress on the body, and ways to manage stress. Schools can also promote mindfulness with interactive activities such as mindful breathing, meditation, and mindful movement, like yoga and progressive muscle relaxation. Peer relationships are incredibly important in adolescent acceptance, thus it is imperative to have group discussions about how students practice mindfulness in everyday life. Students reported lower ratings of anxiety across elementary, middle, and high school age levels after mindfulness activities. Outcomes of mindfulness intervention include decreased anxiety, decreased depressive symptoms, decreased negative coping behaviors, and increased positive coping behaviors. Provided by the CDC's Promoting Mental Health and Well-Being Action Guide. Social, emotional, and behavioral learning consists of developing the skills, knowledge, and attitudes necessary for individuals to understand and manage their emotions, build healthy relationships, and make responsible decisions. When there is an emphasis on social and emotional learning, kids learn how to be self-aware and process feelings and emotions. They learn to develop relationships, resolve conflicts, be empathetic, problem solve effectively, and develop the capacity to have lifelong positive relationships with others. School-based programs can promote social skills and emotional development by focusing on the following: self-management, responsible decision-making, relationship skills, social awareness, and self-awareness. Schools can integrate opportunities to build these skills into daily classroom learning. For example, if a teacher is to work with their student, collaborate to determine classroom rules, how they should be followed, and the consequences, students are demonstrating social, emotional, and behavioral learning. They are exerting self-awareness, self-management, social awareness, relationship skills, and responsible decision-making in this one simple task of creating and following their own rules as a group. Outcomes to the implementation of social, emotional, and behavioral learning, as found in the CDC's Promoting Mental Health and Wellbeing Action Guide, include decreased depressive symptoms, decreased internalizing behaviors, such as feelings of anxiety, withdrawal, and depressive symptoms, decreased anxiety, and increased mental health and well-being resilience. School connectedness is the student's belief that adults and peers in school care about their learning and about them as individuals. Students crave the feeling of being cared for, being supported, and belonging. Schools can enhance students' feeling of connection to their peers, teachers, and the school community through relationship-building interventions. These interventions promote positive family-school relationships through frequent two-way communication between parents or caregivers and the school staff. Interventions can be tailored to meet the unique relationship-building needs of different student populations. It is important for parents, teachers, and all school staff to use open and supportive communication techniques to earn the students' trust. Techniques such as active listening, supportive body language, contextual feedback, and acknowledging the student's point of view. Outcomes to implementing effective communication from the CDC's Promoting Mental Health and Wellbeing Action Guide include a decrease in internalizing behaviors, feelings of anxiety, withdrawal, and depressive symptoms. Also, relationship-building interventions that are tailored to address the unique experiences in children with or at risk for disruptive behavior problems lead to reductions in teacher and parent-reported internalizing behaviors. Cognitive behavioral interventions teach students to identify their own unhelpful thoughts and replace them with alternative thinking strategies. These interventions also often try to get students to engage in positive activities and coping behaviors in their lives, which can improve their mood and other symptoms of distress. The first step in cognitive behavioral therapy and the development of coping skills is promoting acceptance. Students need to feel comfortable and supported in order to explore which behaviors align with their personal values and which do not. Staff can promote acceptance of the student's current circumstance while preparing them to make behavioral changes. When promoting acceptance, students are more open and willing to engage in cognitive behavioral therapy and coping skills lessons. Results from the CDC's Promoting Mental Health and Wellbeing Action Guide show that promoting acceptance increases coping skills, decreases depression, and decreases somatic symptoms. Cognitive behavioral interventions educate students on ways they can manage their thoughts and behaviors. Modular cognitive behavioral interventions have been shown to help K-12 students with anxiety and other internalizing behaviors. Study modular CBT for childhood anxiety disorders, evaluating clinical outcomes and its predictors, evaluated student response through 7 cognitive behavioral models. First being psychoeducation. The next module focused on coping and task concentration, followed by the Think module, focused on cognitive reconstructing. Next cognitive behavioral intervention practiced felt emotions, relaxation, and mindfulness techniques. In the Do model, students completed interactive activities based on experiment and exposure. Module 6 focused on the effects of parenting style, parental dysfunction, and co-parenting on a student. The final module focused on relapse prevention and educating students on ways not to fall back into pattern. The study showed that 59 to 70% of children tested were free of their primary anxiety disorder and experienced a large decrease in anxiety symptoms at follow-up. In accordance with the CDC's Promoting Mental Health and Wellbeing Action Guide, outcomes of cognitive behavioral therapy include decrease in depression, decrease in anxiety, decrease in post-traumatic stress, and decrease in internalizing behaviors. Similar to social, emotional, and behavioral learning programs, coping skills training often emphasizes strengthening resilience and learning to practice skills outside of a small group. Proper coping skills encourage students to practice a growth mindset. Coping skills can be individualized to each student based on what best helps them handle specific struggles and periods of adjustment. Examples of coping skills include deep breathing exercises, progressive muscle relaxation, exercise, yoga and meditation, journaling, cognitive reframing, engaging in personal hobbies, and sensory grounding, which is locating tangible things with all 5 senses, something you see, hear, smell, feel, and taste, as well as any other positive coping methods a student may find helpful. Positive and effective coping skills result in decreased anxiety, decreased depression, and increased coping. Next, we will speak on the resources available to school communities and individual students struggling with their mental health. Shown are some of the logos for programs and resources currently available in New Jersey. Mental health is a crucial factor in determining an individual's, especially students', overall quality of life. Many elements influence a student's psychological well-being, including genetics, environment, and social factors. Community support and available and local resources play a vital role in positively affecting mental health. Any form of support helps students manage their stress and navigate difficult times. The first community resource is Children's System of Care. New Jersey's public behavioral health system, known as the Children's System of Care, CSOC, provides services to individuals under the age of 21 with emotional and mental health needs or similar issues. They provide community-based, culturally competent services and support tailored to the needs of youth and their families. Services can be provided by calling their number listed here or found in the link provided. New Jersey Mental Health Cares serves as the provider of behavioral health information and referrals in New Jersey. Their team of behavioral care specialists utilizes their knowledge of the behavioral health system to help individuals access the information and services they need. Second Floor is a confidential and anonymous helpline for New Jersey's youth and young adults dealing with mental health issues and other concerns. Their goal is to find solutions to the problems individuals face, and they are available 24/7, 365 days a year. Their phone number is 1-888-222-2228. The link is included below. It also has apps that can be downloaded for free from the App Store or Google Play Store. Soluna is a confidential well-being app that provides mental health support and resources available to NJ teens aged 13 to 18. It offers one-on-one licensed counseling from Monday to Friday, 2 p.m. to 8 p.m., and on the weekends from 2 p.m. to 6 p.m. They're also accessible for drop-in chats every day from 2 to 8 p.m. During difficult times, the 988 Lifeline is available to individuals facing challenges and needing someone to talk to. Contact the 988 Lifeline via call, chat, or text, as they offer a unique approach to life struggles, reminding individuals that they are not alone. Whether you're dealing with mental health issues, emotional difficulties, substance use problems, or just need support, their caring counselors are ready to help. Students without health insurance may be eligible to obtain coverage. That link is also provided here. Once the insurance is obtained, individuals can seek treatment at local hospitals such as Hackensack Meridian Health to improve the quality of their mental health and overall life. This slide includes some potential handout materials, posters, and pamphlets available to hang up in the school or send home with the students. Please take a look. For a student to be considered in need of referral for accommodation, there are requirements, programs, and documentation in place. First, under FAPE, all New Jersey students have the right to free, appropriate public education. This law ensures that each school is obligated to identify and evaluate a student who needs or is believed to need special education accommodations while in school. Students with anxiety disorders have difficulty concentrating, affecting their school performance. A 504 plan outlines specific accommodations needed to address a student's disability and ensure equal access to education. Anxiety is considered a part of Section 504 if it inhibits major life activities such as learning, concentrating, and participating. 504 plan eligibility requirements include feedback from teachers, coaches, and counselors, test taking results, parent feedback, and classroom performance. Most students with a 504 plan remain in the traditional classroom setting with accommodations such as extra time on test or assignments and an assistant teacher or aide. Students K through 12 are also eligible for an IEP. The term IEP is an acronym for Individualized Educational Plan. In New Jersey, an IEP is a written document that outlines a young person's education, ages 3 to 21 with special needs or disability. There are 5 steps in obtaining an IEP. A student must obtain a special education evaluation referral from a teacher, parent, or other school personnel. The referral can be written or verbal, and guardian consent is needed for evaluation. Evaluations are typically conducted by school psychologists to determine if a student is eligible for an IEP. If the student does not qualify with the school physician, they can obtain an independent educational evaluation. After evaluation is complete, a team of professionals meet to discuss evaluation results. If a student is not found eligible, they can request a hearing to challenge the decision. If the child is determined eligible for special education services, an individualized plan will be put in place within 30 days. Teachers, parents, and youth collaborate to determine the best avenues for support at home and school to ensure academic growth while following the student's IEP. Some modifications include the opportunity to take tests in a different location with extra time, allowing makeup work without penalty, excusing late arrivals or absences, and allowing extra breaks if needed from class. There are many ways teachers can help students suffering with anxiety and depression. They can help by talking with parents to get a deeper understanding of the student and finding ways to best support them both in and outside of school. Teaching them how to calm down by using techniques like breathing and relaxation, promoting relaxation methods, and encouraging breaks throughout the day are good examples, as well as taking extra steps by offering daily schedules to help them stay on track, adjusting assignments and reducing workloads as needed, and helping parents with transportation to school, even if it means a late arrival or adjusting class schedule. Thanks so much for watching!